Welcome back to 30 Days to a Better Birth. Today, I want to talk about your birthing environment. So we touched on this a little bit when we were talking about who to have at your birth. But now we're going to talk about where you want to give birth and what you want your environment to be like. So there are three main options when considering your birth location. You have the traditional hospital birth option, and then you have a home birth with a midwife or a birth center birth, which would also be with a midwife. And sometimes those are associated with a hospital. So they'll be near a hospital so that you can transfer over in the event that that is necessary. So with a home birth and a birth center birth, you will be opting into an unmedicated labor and birth experience. In the hospital, you have access to more of those medications. So if you are planning to do a medicated birth or to have some sort of medical intervention or you're a high-risk pregnancy, then a hospital birth will be the route that you choose. So for a home birth and a birth center birth, you do need to be low risk. You will meet with the midwives ahead of time to have a consult, and you will go through your past medical history, your pregnancy history, any past pregnancy histories, anything that is pertinent, they will cover to see if you are eligible for a home birth and a birth center birth. So that is the initial step when you are choosing a hospital birth, home birth, birth center, is to figure out your eligibility. There are certain factors that would risk you out of a home birth or a birth center birth. So that is something to consider when you are making that decision. And the midwives will guide you through that, and they will let you know their comfort level and if they feel as though you are low risk enough for that option. And then the next step in choosing your birth environment is, what is your birth vision? Like, do you want to give birth in water? Do you want to give birth in your bed? Do you want to give birth in that more medicalized setting? Do you feel safest there? So that is another factor in choosing your birth environment. Sometimes a water birth is not an option with other birthing locations besides a home birth. If a water birth is something that is important to you, you want to confirm with your birthing location that this is an option. You want to ask your midwives if they feel comfortable birthing in water. You want to ask the hospital what their policies are for water births. It would be great to ask if the labor and delivery rooms have a shower, if they have a tub. If they don't have a shower and a tub in each room, is there certain rooms that do have them if you are planning for an unmedicated birth and would really love to utilize hydrotherapy or water in labor for pain relief? And then another thing that you might notice is that some hospitals or birthing centers have one or two tubs that are not in the room, but that you can use if that is something that you are interested in. Make sure you bring that up with your birth team. When you are making your birth plan, it's good to take things into consideration, like the lighting. Do bright lights make you anxious? Would you prefer to have a nice ambiance with the lights down low, with flameless candles, with fairy lights, something of that nature to kind of set the mood? Do you want to put up affirmations around the room to refer back to during labor to give you some motivation? Some people will handwrite their own, some people will buy them off of Etsy or Amazon, and they'll hang them around their birthing space to give them that extra motivation. Are there any scents that you really love, like aromatherapy, essential oils? You can use a cotton round and put a few drops of essential oils on that and pin it to your shirt, or just hold it in front of your face when you want it. Ginger is really great for nausea. Lavender is really great for relaxation. So there are definitely aromatherapy options that are great in labor to help improve the experience. And then, are there any other tools that you would like to use? A birth ball, a peanut ball, a birthing stool, a comb for the gate control theory of pain to kind of distract yourself from that pain. And then, do you want to be in your birthing location early? So if you are choosing to do a hospital birth, do you want to be there sooner rather than later to utilize some of those pain relief options? Or would you rather labor at home as long as possible and as long as it's safe to do so, so that you can use your own shower, your own tub, your own bed for resting? What is going to be most comfortable for you, and what environment is going to be conducive to a positive birth experience? Is that your own home? Is that where you feel safest? Is that a birthing center? Is that a hospital? Do you love to have all of the resources there just in case? Or are you more comfortable knowing that things aren't going to be as heavily medicalized during your birth? The other birthing environment that you should think about is if you're going to be giving birth in a traditional labor and delivery room, the OR. So pretty much universally, hospitals do not deliver breech babies vaginally. So a breech baby is when they do not come down head first, they come down butt first or foot first. And that is a situation where most OBGYNs and midwives feel more comfortable delivering via cesarean section. So with your traditional OBGYN, you will likely have a C-section if your baby is breech. Some out-of-hospital providers will deliver a breech baby at home, but sometimes they don't feel comfortable with it either, and they will refer you to the hospital for a C-section most of the time if your baby is breech. So that is an excellent question to ask your provider, what the protocol is if you do have a breech baby. So can you deliver baby at home if you have a midwife, or will they transfer you to the hospital? If you're giving birth at a hospital, are there any providers that support a breech birth, or will it automatically be a C-section? If you're having twins, sometimes they will offer you a C-section for that as well. You can definitely give birth vaginally with twins. They usually want baby A to be head down, and then sometimes baby B is delivered vaginally, even if they are breech. Usually with twin deliveries, if you have them at the hospital, they will have you deliver in the OR just in the event that something happens that they need to do a C-section, either with both babies or with one baby. There are different sets of preferences that you can have if you are having a cesarean section as well, which we will talk about at a later time. I always recommend that you have backup plans. So if you are planning a home birth, we also have to plan for a home birth transfer. So where are you going to transfer? What are your top 3 locations? What's the closest hospital? Is that also your preferred location? So in a true emergency, you would go to the closest hospital. If that is not your number 1 preference and it's not a true emergency, which would be for like maternal exhaustion, long labor, wanting pain medication, then you could transfer to your preferred location if that is not the same as the closest. With any birth, it's also a great idea to plan your preferences for a cesarean section. Having the plan for that birth environment, no matter what your original plan is also ideal. Thank you so much for being here for this 30 Days to a Better Birth journey. I hope you will subscribe and join us again for the next video in this series. Have a great day.